Hi, I am Dr. ROJoson, Director of the ROJoson PEP TALK. My PEP TALK today is entitled Patient Management Process, Selection of Treatment Process. The empowerment objective is for lay people to have an understanding of the selection of treatment process in the patient management process. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I launched this PEP Talk on May 15, 2021 with a module on COVID-19. The second module was on patient empowerment. I am now on my third module entitled Patient Management Process. What I have in mind in my PEP Talk, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. This is my key performance indicator. I hope you will be in my group of 30. This is the patient management process framework. This module has 6 parts: overview, clinical diagnostic process, paraclinical diagnostic process, selection of treatment process, advice to patient process, and peculiarities and limitations of medical practice. Today, I'll be tackling selection of treatment process. We'll be focusing on this box. The takeoff point for selection of treatment process is the pre-treatment diagnosis. Before the selection of a treatment procedure, the physician decides on the pre-treatment diagnosis, which is obtained from repeated assessment of the accuracy of the clinical diagnosis and paraclinical diagnosis and correlation of the two. He advises the patient on the pre-treatment diagnosis. He then spells out the objectives or aims of the treatment. In the selection of the most cost-effective treatment procedure, the physician uses the BRCA processes. B stands for benefit, R, risk, C, cost, A, availability. The physician gives or lists the various options of treatment procedures and then gives data on the BRCA. With the data given, the patient is asked what he prefers. The physician tabulates, compares, and analyzes the options and the BRCA data like this. First column is listed the various options. Then on the second column, the goal of the treatment or the benefit. The third column, risk, and fourth column, cost, and then fifth column is availability. Illustration 1 of the selection of treatment process. Option 1 has the greatest survival rate benefit compared to 2 and 3. Option 3 has the least survival rate. Risk for all these 3 options are acceptable. And then the cost is 5,000 for option 1, 4,000 for option 2, and 3,000 for option 3. And all the treatment options are available. So which is the most cost-effective treatment? Option 1. Another illustration. Survival rate is the same for both option 1 and 2, but the risk is lesser for option 1, and the costs are the same, and both are available. Which is the most cost-effective treatment? Option 1. Another illustration. Option 1 and option 2 are equally effective, have acceptable risk. But option 1 is 8,000, cost 8,000 pesos, and option 2, 4,000. Both are available. So which one is the most cost-effective treatment? Option 2. Another illustration. Option 1 is the most effective, and then compared to the other two, with option 3 being the least effective, the risks are all acceptable. And then the cost is 2,000 for option 1, 3,000 for option 2, and 4,000 for option 3, and all are readily available. So which is the most cost-effective treatment? Option 1. At this point, the physician should be explaining the processes of selection using the BRCA to choose the most cost-effective treatment procedure and to the desire of the patient. He can recommend, he waits and answers queries from the patient, allows the patient to decide, and forges a shared agreement. Once a shared agreement is arrived at, an informed consent or informed refusal is formalized. If there is an informed refusal, the treatment is not executed. If there is an informed consent, the treatment is executed. Just before, during, and right after the treatment procedure, the physician advises the patient on the preparation, outcome, things to monitor, etc. After treatment, the physician advises the patient on health restoration and maintenance processes, the do's and don'ts, recovery period, resumption of major life activities, restoring and maintaining healthy lifestyle, etc. With this step, one whole cycle of patient management, inclusive of involved processes, is completed by the physician with the full participation of the patient. At this point, I'd like to end this pep talk. Okay. The end of the selection of treatment processes and end of health restoration and maintenance processes after treatment. Takeaway in this pep talk that are related to patient empowerment. At this point of the pep talk, understand the patient management process framework in terms of what the physician are doing and should be doing in the selection of treatment process and health restoration and maintenance processes after treatment. Be ready to ask questions based on requirements of the processes, particularly when a physician is not using the processes or is not clear or full in explanation. Participate actively and fully in the problem-solving and decision-making of your health concerns with your physicians in coming out with the most cost-effective treatment procedure and to your desire. Master the selection of treatment processes as they may help you in some way in deciding for your own health concern and on how to choose the most cost-effective one and to your desire, particularly when there is no healthcare professional around to assist you. This is one other way of gaining greater control in your health concerns and issues. I will end this pep talk, or this part 1 of the pep talk, and add some more. I'd like to discuss the common issues related to the selection of treatment processes, unnecessary prescription, expensive prescription of medicine, unnecessary operations, and generic drugs. Let's start with the unnecessary prescription. In the Philippines, it is a common expectation of patients that at the end of a medical consultation, there should be a prescription of medicines. This mindset is primarily instilled or influenced by the practice of a lot of physicians who would routinely prescribe at least one medicine, even when it is strictly speaking not needed. The physicians would usually like to shorten the medical consultation by prescribing a medicine rather than spending time to explain the diagnosis, basis of diagnosis, treatment options, including why a medicine is strictly not needed. The physician's writing the prescription is a signal to the patient on the end of the medical consultation. Strictly speaking, not all medical consultations should end up with a prescription for medicine. In fact, there are a lot of medical consultations that end up with clinical diagnoses that need advice only and do not need a prescription. If only the physicians will explain fully and clearly the clinical diagnosis that, strictly speaking, do not need medicine for treatment, then there will be less unnecessary prescriptions, less side effects from medicines prescribed, and less expense on the part of the patients. There are a lot of medical consultations that end up also with clinical diagnoses that only need supportive management, like rest, change in lifestyle, hydration, nutrition, exercise, and hygiene. No medicines are actually needed. Examples in this era of COVID pandemic, a lot of asymptomatic and mild COVID-19 patients are taking a lot of unneeded medicines like antibiotics, vitamins, immune boosters, etc. The World Health Organization has declared that they are not needed. Second issue is on expensive prescriptions of medicine. A lot of physicians prescribe medicines without regard to the patient's financial ability to procure. They don't use the selection of treatment process. They may be influenced by trends and fads and/or by the pharmaceutical companies. Thus, it is important to discuss with your physician on the medicine prescribed if there are other alternates which are as effective but cheaper. Do not hesitate to ask if the medicine has a generic counterpart. The next issue is on unnecessary operations. There are a lot of unnecessary operations going on. Here are some examples that I'm aware of and part of my advocacies. Beware of unnecessary operations for gallbladder polyps. No need if the polyp is less than 1 centimeter. Beware of unnecessary breast biopsy for suspicious lesions reported by the radiologist. This may turn out to be fibrocystic changes. Beware of unnecessary breast operations. Macrocysts of the breast can be treated with needle aspiration with no need for excisional operation. Beware of unnecessary thyroid operations, which may not be needed for a small benign thyroid nodule. The last issue is the generic drug. Commonly asked question, is it advisable to use generic drugs? My answer is an outright yes. It is advisable. What are generic drugs? A generic drug is a medication created to be the same as an already marketed brand name drug in dosage form, safety, strength, route of administration, quality, performance characteristics, and intended use. The generic medicine works in the same way and provides the same clinical benefit as the brand name medicine. In other words, you can take a generic medicine as an equal substitute for its brand name counterpart. Generic drugs tend to cost less than their brand name counterparts because generic drug applicants do not have to repeat the animal and clinical human studies that will be required of the brand name medicines to demonstrate safety and effectiveness. So that is why generic drugs cost less than the brand name medicine. Are generic drugs at par with the brand name medicines? Yes, because they contain the same active ingredients as the brand name medicines. Also, the Food and Drug Administration has already looked at the quality of the medicine before they are approved to be marketed in the country. Thus, generics should have the same quality as the branded ones. If the generic drugs are fake and not approved by FDA, then they may not be safe and effective. Thus, it is important to get medicine only from FDA-approved pharmacies. So if we take a look at the selection of treatment process, it is but rational to choose the generic drugs because they are as effective as the brand name drugs, same risk, and cost less. Thus, it is advisable to use generic drugs as they are more cost effective. So with this, I end my pep talk today, patient management process, selection of treatment process. I hope I have empowered you to have a better understanding of the selection of treatment processes in the patient management process. With that, I'd like to say thank you for your kind attention. Mabuhay kayong lahat.